Okay, so here we have the spleen. Notice here we have the diaphragm, and here we have this empty space. This empty space right here would actually be the stomach. So your spleen is this structure right here. Notice we have all these little vessels kind of running to it, and here is the pancreas. So we are behind and kind of to the back and side of the stomach here, or what they would call posterolateral. Now, the region of the spleen where we're going to have all these blood vessels coming in, we're going to call that the hilum. That should sound familiar. That's kind of what we tend to talk about a lot with most organs that have this kind of central region for those blood vessels to come in. Now, one of the reasons that the spleen is important is because this is where we're actually going to house lots and lots of our T and B cells, as well as other macrophages, okay? We're gonna be holding these in what we call the white pulp. So it is white pulp because T cells, B cells, and macrophages are all white blood cells, okay? So the white pulp is going to contain white blood cells and clusters. So T cells, B cells, and macrophages are going to be found here in this kind of white pulp of the spleen. Also found in the spleen, we have red pulp. Red pulp is red because of the erythrocytes. Now, there are also platelets, macrophages, and other B lymphocytes found in this region, but we have lots and lots and lots of platelets and erythrocytes. Something like 30% of all of the platelets in your body are actually going to be found in the spleen. Now, what this tells us, though, if we have a whole bunch of platelets, a whole bunch of erythrocytes here, well, what are we actually doing with these? Well, we are holding these in reserve. So the spleen basically acts like a blood reserve in the case of hemorrhage or like drastic injury. That's also one of the reasons why we have so many platelets there. Because if we're losing blood, and we're losing lots of blood where we need to get additional blood flow in, we also want those extra platelets to help make sure that we can stop any additional blood flow, or at least slow down any additional blood flow, okay? Now, also found in the red pulp, we're going to find what we call splenic cords, and we have these really cool capillaries in here called sinusoids. Remember that sinusoids were the ones that had those really open walls on the outside? It makes sense that we have really, really open vessels because this is where blood is able to get out, but also where we can get all these other blood components back in. If they were more closed off and they had complete basement membranes, we wouldn't actually be able to get cells into and out of them very well. So this gives us a way to get those cells in and out. So like I said, the red pulp is where we're going to store erythrocytes and platelets for really traumatic injuries. White pulp is where we're going to store T cells, B cells, and macrophages. So here we have the spleen. So here we can see this big line right here. This big line is what we're going to call a trabecula. So that's this little bridge-shaped structure. So here we have red pulp. So notice all this kind of stuff over here. This is just all red pulp, okay? White pulp is going to be these white regions over here. So these kind of eye-looking structures are the white pulp, okay? That's the easiest way to kind of think about it, is that the white pulp is going to tend to look like eyes, while the red pulp is basically just going to be the kind of red stuff that's out in between. But all these red blood cells and stuff like that is also going to provide the spleen with some of that deep red color that we can use to help identify it as well.